Dr. Berry, with the new changes to mask rules, should I be wearing a mask?
That's a great question. Things got a lot more complicated and a little confusing in recent weeks with the updates from the CDC and the Washington State Department of Health. So the most key thing to know is if you are unvaccinated, you absolutely should wear a mask when you're around other people, especially indoors. If you are vaccinated, you largely can go unmasked in most settings, but there are a few exceptions to that. So you should wear a mask if you are in some kind of transit. So if you are on a bus, a train, or a plane, that's a shared airspace where you're quite crowded with other people, and you do still have to wear a mask in those settings. I also recommend wearing a mask when you're around large numbers of unvaccinated people in an indoor setting, or large numbers of people where you don't know their vaccine status in an indoor setting. And so that includes especially children. So kids under 12 are not eligible for vaccine yet. So if you're in a place where you're gathering around small children, think schools, daycares, then it's really important to wear your mask in that context, even if you are vaccinated. It's also still required to wear a mask in healthcare settings or in jails, prisons, or shelters. Otherwise, you can largely go without a mask. There is one other key group that's important to take care around, and that's people who are immunosuppressed. So people whose immune systems can't respond that well to the vaccine. Think people who are on immunosuppressant drugs, people with cancer, certain genetic immunodeficiencies. If you're around someone in that situation, their vaccine isn't fully protecting them. So we really recommend that they wear a mask and that you wear a mask around them too.